I'm Dr. Sudhir Kalhan. I'm the Senior Consultant and Co-Chairman of the Institute of Minimal Access and Metabolic Surgery at Gangaram Hospital. My department basically deals with huge patients, the obese, the super obese, and we offer them what is known as bariatric surgery. Now, this is a branch which deals with huge people, and we have devised some simple laparoscopic operations which can help these patients and give them a new life. 20 years back, in 93 or so, I had gone to USA, and that is the time I saw these huge people over there, and I thought probably as an Indian probably never see such patients. Today in my own OPD I see surprisingly and shockingly huge children, children 160 kg, 140 kg. We have seen up to 230, 240 kg patients coming to our clinic in India. Now these are huge people who have developed diabetes, hypertension, sleeping disorders, joint pains, difficulty in breathing, and all these patients need help. If you ask me, bariatric surgery in the world basically is divided into two categories. One is predominantly what is known as a restrictive procedure, that means you restrict the amount of food somebody can take. And the other is what is known as a malabsorptive procedure or a gastric bypass. Well, if you see people in the West who take a lot of non-vegetarian food, we can afford to do a malabsorptive procedure in them because, along with the nutrition, their also proteins are going to go down, their multivitamins are going to go down. So these patients will require regular supplements throughout their life. Also, these patients need to be intelligent and need a regular follow-up. Our Indian patients are a little different. How we are different is, first of all, for the same BMI, we have more adiposity. The truncal obesity is much more in the Indian. Our dietary habits, most of us are vegetarians. Most of us take high carbohydrate diets. Now these diet is high in the glycemic index, very low in the protein. An average Indian does not take more than 20 to 30 grams of proteins, whereas he is required to take about 60 to 80 grams of proteins. So on these patients who are already malnutrition in proteins, it would not be advisable to do any malabsorptive procedure. So at Gangaram Hospital, for the last 5 to 6 years, we do a simple procedure which is known as a sleeve gastrectomy. If you see over here, this is how a sleeve gastrectomy is done. And a sleeve gastrectomy, what you do is, you reduce the size of the stomach into 1/10 the size. So the patient, if you see here, is now able to eat only 1/10 of the food is about to eat. Also in this area of the stomach which is removed is the hunger hormone which is known as ghrelin. Once you remove this fundus, 90% of the hunger hormone of these patients comes down. So ghrelin comes down, they eat less, they are hungry for less, and slowly gradually they lose weight without having any malnutrition. So I think this is the most suited surgery for our country, and now we have strong data from our own center at Gangaram where we've seen our patient doing very well and their overall quality of life improves. See, my association with credihealth is only recent, but I have seen a very energetic team, very focused team who understands what healthcare is all about. And I must tell you that in India, the information technology is now something which is available even in the villages. It's the fastest, easiest way of reaching out to everybody else. And our Prime Minister is an example of that. So I think health, education, school health, making children aware of obesity, making parents aware of obesity, we will be needing something like credihealth to go and reach to the people and be a link between the doctors and the people. We what as doctors need is somebody who can interact with us and become the via media of spreading this information to the patients. A large portion of healthcare is all about prevention. Prevention still remains better than cure. What we need to do is probably what the New York State has already done, that is reach out to the schools. You will be surprised that in New York, all schools, it's mandatory to do a BMI, that means the weight and height analysis of all the children, which is done every month. And any child who's above the desired BMI, their parents are counseled. So much so that so many times, even a nutritionist is sent to the home of the child to see how the cooking has been done. This is fantastic, and you'll be surprised that within 1 year, New York State Health has been able to decrease childhood obesity. See, we as Indians, we are proud that we are a young nation, isn't it? But if this young nation becomes a diseased young nation, you can imagine the economic burden of our country. the present statistics show that 30% of the school going children are overweight. And out of the 30%, another 30% are going to develop diabetes when they reach 20 years of age. So you can imagine that by 2020 itself, we will become the diabetic capital of the world, which is a very, very worrisome thing. WHO has declared that diabetes is the fastest rising epidemic of the world. If we don't do something now, we're going to repent it.
You're right.
In 10 years, we are going to be a young nation, but a nation which might have a lot of disease burden, and we must concentrate on that. In the Man Ki Baat, which the Prime Minister did just now with Obama, the first talk was on obesity. And Obama told our PM that in America they are really controlling obesity because obesity is a big economic burden on the society.
You're right, sir.
And it's high time that we realize that we are not far away. Our metros, the Delhis, the Mumbais and the Ahmedabads, obesity is rising 10 times. Every year on year we see a 10% growth in the number of patients coming to our clinics over there. It says that obesity is here to stay and we have to do something about it. Of course, the first important thing is school health. We have to monitor our children. Secondly, we must make people aware that what they are eating, how they are eating. The best thing I tell people is that don't diet. And then everybody laughs at me that you are telling us not to diet. Yes, do not diet. Dieting is not going to make you lose weight. What you have to do is divide your calories into 5 meals and take small frequent meals. This will keep your body stimulated, keep your BMR high, and it's going to help you lose weight. Also, please incorporate a little bit of exercise in your life. Even if it's 20 minutes morning, evening, do that. Stop eating out more than once or twice in a week because all the food that you eat out is high in calories. Stop taking buffet lunches and dinners because they are a free-for-all unnecessary calories. And now I think there are some very, very interesting applications which are available on your phones. You can actually keep account of your calories. MyFitnessPal is one example of that, in which even Indian food like a muruku or even a chakli or a gulab jamun or a methi parantha, it gives you the calories. So you can start, and when you start calculating your calories, you realize that how much you are overeating. I'll give you my own example. My morning cup of tea, I used to take 2 biscuits, sometimes even 3. But when you realize that every biscuit that you take is about 30 calories, and if you walk for 500 steps, you burn 30 calories. So for every biscuit that you have to eat, you have to walk 500 steps. So if you stop taking 2 biscuits in a day, by the end of the month, you're going to lose 1 kg. So how's that? That's it. So calorie count is very, very important. It's a simple thing, energy in and energy out. How much money you put in a bank and how much money you withdraw from a bank. If you keep on putting money in your bank and do not extract money out, your deposits are going to go up. That is, your fat deposits keep on going up.
Yes.